Okay, welcome everyone. This is our 14th CHW professional development webinar in this series. We have never taken a month off, which is really exciting. I'm personally very proud of. If it's your first time joining, I'm the program manager for the South Texas Community Health Worker Workforce Preparedness Collaborative. We're funded by HRSA to extend and enhance the community health workforce across South Texas. And part of that, as a part of that, we believe in enriching CHWs with soft skills to help them thrive. And so with the exception of one Excel workshop, the other 13 webinars have all been on soft skills related to performing as a CHW. So having difficult conversations, finding mentorship, avoiding violence in the workplace, giving and receiving feedback. And so today is our final soft skill webinar. It's on networking skills for CHWs. I think this is a unique skill because as a CHW, you need to network to know what resources are available in your community and across the state. When we talk about like digitizing the community health workforce, there's a lot of suggested solutions on how do we do referrals better? How do we make CHWs known or aware of the resources that are available? Just because they were available yesterday, maybe they're not available today. And so you all take on a lot of work when it comes to networking. And then personally and professionally, networking is important for your own career. Many of you probably know that being a community health worker is very contract-based, or you're jumping from project to project. And so you need to look out for your own career. You should also be developing skills and networking. And I'm probably getting ahead of our speaker on this, and so I won't say anything more. So I'm very happy that we're joined by Dr. Marilu Vazquez. She's a program manager with TEPHI, which is the Texas Epidemic Public Health Institute, housed out of the UT Health School of Public Health. You probably have heard about them in the last few years, especially with their good work during COVID. If you're not on their listserv, I suggest you join it. There's lots of free trainings. They are always making announcements on new and emerging outbreaks. So please sign up for them. At the end, you can take this survey. I'll put the link in the chat box once I'm done sharing. If you are a certified CHW, then you will get one non-DSHS certified CEU for today. And then I mentioned this is the last of our soft skill series. Starting next month, we're going to be starting a series on public health training. And so over the last year, the collaborative has developed 7 modules focused on public health skills. And so we're marrying public health skills or competencies with community health worker competencies. In doing this series, it's all state certified. So if you attend each one, you can get 1.5 hours of credit. So starting in August, please reserve 90 minutes, 12 to 1:30. I know I'll be a little bit harder, but please advocate for yourself with your employer that this will be really important. And at the end, you can call yourself a public health CHW. And so just briefly, when you go to sign up, there's one registration link, which is really cool, and I'll share that in the chat box. You will have all 7 dates listed, the titles of those webinars and the speakers. So you can choose to sign up for one, all of them, or whichever ones that you're interested in. We'd prefer that if you sign up for all of them, you get the Zoom invite, and then you make the decision that day if you can make it or not. And we will always be sending out recordings, although we will only give CEUs if you are there in person. So we're going to go over, in general, the role of CHWs in public health, an introduction to project management and leadership, the role of data in our work, and the role that how CHWs can ethically advance the utilization or the collection and utilization of data. I'll be going over project evaluation for public health projects. Dr. Stone will be focusing on health literacy and going to depth on the teach back skill. Dr. Cantu, she's in the School of Nursing here at UT Health San Antonio. She'll do a module on public health policy, and then Dr. Stone comes back for public health advocacy. So please plan on this. In general, it's the 3rd Thursday of each month, except in February. It'll be the 2nd Thursday, and then we are taking December off. And then lastly, if you haven't signed up to this listserv, please sign up. When I find out about other training opportunities or jobs in your area, that's this is the list that I use. All right. Without further ado, Marilu, I will hand it over to you.
Thank you. So thank you so much, Cyan, for the inviting me to present to your amazing group. I'm going to go ahead and share my screen. So give me 1 second. Okay. So can you see?
Yes, I can.
Okay, perfect. So again, thank you so much for inviting me to speak today. I'm very excited to be here and speak to your group. And wow, that's wonderful about the public health CHW program. And you guys are doing some amazing things. So I'm glad that I get to hear about that and hopefully be a part of it as well. So I would like to especially thank Cyan for obviously inviting me. And also I'd like to point out that, you know, the topic of today's discussion is about networking, and Cheyenne and I actually met while we were both networking. We met, even though we both work for big universities and big groups in San Antonio, we actually met about an hour away in Atascosa at a community meeting. And so it goes to show you that, you know, networking and relationship building, we are a prime example of the result of that. It's just one little example, but I think it's very important to point out today as I was preparing for this discussion. So some quick objectives, like she mentioned, it's a soft skill discussion, so nothing too serious, but I would like to talk about some brief objectives. So obviously welcome and introductions, which we've done. I'm going to talk a little bit about TEPHI. She touched on my organization a little bit. I'm going to talk about the importance of networking and relationship building in our particular with CHWs, some networking opportunities that maybe you haven't thought about or come across, and some elements, just a few brief elements of relationship building and what that means, again, in our professional careers, some conclusions, and of course, some questions and comments. Hopefully we'll have time for that. A little bit about me. So yes, I am Marilu Vazquez. I do have some letters after my name that I'm quite proud of, but I'm very proud to also be a certified community health worker, and hopefully soon to be a community health worker instructor as well to add to the list. I like to tell everyone that I'm not a native Texan, but I got here as soon as I could. So I've lived pretty much everywhere in Texas except for North Texas. I went to high school in South Texas, came to college in San Antonio, went to West Texas and Lubbock and El Paso for medical school training, and then went all the way across the state to Galveston and Houston for my residency training. I'm old enough now to say that I've had some previous lives or eras, as Taylor Swift might say. So I initially, when I finished my training, I completed a public health and preventive medicine fellowship. I worked as a family medicine and emergency room physician very early in my career, became a wife and mother, still a wife and mother, did some clinical research and was faculty at UTESCA. And then more recently, in the last 4 to 5 years, I kind of circled back, and that's kind of the reason why I mentioned this story, is that I kind of circled back to public health. So during COVID, I joined the UT School of Public Health in Houston, but actually worked in San Antonio for their contact tracing and case investigation during COVID, which is very, very interesting and eye-opening and very fulfilling work that I love doing, in conjunction with the Metro Health Department here in San Antonio. And then once COVID, we finished that case investigation project and things kind of settled down, I transitioned within the School of UT Health, still in Houston, to TEPHI, which is a new institute, stands for Texas Epidemic Public Health Institute. And so I work with them now. Again, I work for Houston, but I live in San Antonio, and my region is San Antonio and Region 8, with an emphasis in working with vulnerable populations and emergency and pandemic preparedness. I'd like for you guys to know that I'm a huge supporter and advocate for CHWs. So again, I'm very thrilled to be able to reach you today. I wrote my email there at the bottom. So if you'd like to take a snapshot or write it down, and of course, Cheyenne can get a hold of me, but in case you have any comments or if anything I can help you with, suggestions, or again, a part of building our relationships, you're welcome to email me and let me know that you were at the seminar. So a little bit about TEPHI. So basically the legislature, the Texas legislature, put through an initiative and established this institute as a way to not forget the lessons learned with COVID. As some of you may have some experience, you know, a lot of times when things happen in this country, we quickly jump in, we work on things, and then as soon as it's over, everybody kind of goes their own way. The funding disappears, and we kind of go back to square one. So I think the legislature was trying to really take advantage of what we learned and sort of be prepared for the next one. Those of you who have been involved in public health or know that we knew this pandemic was coming. Anyone who worked in public health knew that 100-year pandemic was coming. We didn't know when or how or precisely what it was going to be, but we knew it was coming. And we also know now that there's other things on the horizon. And so we want to be prepared. So TEPHI basically has 4 main missions, and they include training, so making sure that we're preparing a public health workforce with free opportunities for learning. Early detection, so a lot of work into proactively identifying and tracking infectious diseases, but any other kind of disease as well for our state. As we know, the CDC, the federal agency, the CDC was very instrumental during COVID, but we feel like Texas is a pretty big enough state, and it's important to have our own resources as well that are local, that are very specific to our needs in the state. Another one is communication. So advancing communication, best practices for public health leaders to inform their community. And I think this one is really important because, and again, I think that what they were thinking about was, you know, during COVID, there was a lot of maybe miscommunication, maybe incorrect information, maybe things that we could have done better in public health and otherwise during COVID. And I think that it's important to be really proactive in working on how to improve our communication. And I think that's good for anybody at any time, really, in what we do. And then the last big tenet is creating a public health reserve network. So making sure that we are partnering with statewide stakeholders to make sure that we can help them with the tools, data, knowledge needed to be ready to respond in future pandemics or other emergencies of any kind. And so that's just a little bit about TEPHI and what we're doing. It's very broad. We're barely, you know, fairly new, going into 3 years, and started this institute from the ground up. So it's been fun, but very challenging to sort of come into the space because a lot of people are kind of doing the same thing. So it's very important for us to find ways to contribute and not necessarily reinvent the wheel. So I'm going to point to you our website that Cheyenne was alluding to. So it's really easy, tephi.texas.gov. And I would like to just show you a little bit about, so when you go into our website, point out these training resources tab. We have some public health mini courses, health communication training series, and we also have some community health worker trainings that I thought you'd find particularly interesting. So tephi.texas.gov. And also we have a certificate program, and this one I think is pretty amazing. So again, Cheyenne was alluding to, it's really important to keep up with, you know, your professional development, things to improve your resume if you're interested in public health. This is another way to get a certificate through the UT School of Public Health. Now, I know Cheyenne was discussing the certification for public health and CHW, so this is a little different, but it may be worth your while to look into, or maybe perhaps look into it after you complete her program. And so the certificate is really intended for people that do not have formal education in public health. There's no cost. And the only really requisites for it are to be a Texas resident and have a high school diploma. So really it's open for everyone. So thank you for letting me show you those things, because I think it's important to always see it. So again, if you have any questions, feel free to reach out. And on the website as well, there is a link to sign up for a newsletter if you haven't done so. It's also worthwhile because there's a lot of updates about some of those goals and objectives that I talked to you about for TEPHI, disease outbreaks, and things that are going on in our state particularly. So my role in TEPHI is, so I'm a program manager, that's my official title, but really what I'm trying to do is work a lot on relationship building, forming partnerships, and addressing the needs of the vulnerable populations in the counties that I serve. And so if this sounds familiar, it should sound familiar to you, because that's a lot of what you guys are doing out in the community and in your different organizations. And so again, Cheyenne alluded the importance of networking. So when I think of networking, and so again, I'm probably showing my age a little bit, I think about, the 80s movies or the early 90s movies with, young people being out at a bar in New York City in their business suits, and perhaps, the girls with the shoulder pads and having a drink after work, and trying to improve their maybe their work, their employment. And sometimes a lot of it, what I used to think about is selling, right? People who are in sales, whether they're selling, widgets, I like to call them, or stocks or whatever, a lot of salesmanship going on in networking. But that's, basically what we're doing as well in a way. But I think that for us, we're selling ourselves a little bit, and we're also selling our organizations, right? We want to make sure that we get out there, that in networking, we're putting the word out for what we're trying to do, but also seeking information and resources to bring back to our communities. So it kind of is the same. You're not necessarily selling a product, but you're selling yourself, information, and also trying to get that information back so that you can do your job and bring it back to the communities that you work in. So perhaps a better term for networking in our field may be more towards relationship building, right? And so when we think about our titles, I always think, community health worker, community is built into our title, right? And so part of the big part of the community health worker's job is to engage with the community that we live in, to try to get this information out, to create partnerships, to identify and distribute resources, which sometimes is a little harder than you might think. And some of you who've been out there probably have experienced this, but all of this is in an effort to find better ways to serve our communities and improve, of course, the health and wellness of our communities. But it's also important because there is a lot of information out there. So in fact, in this day and age that we live in, with our computers and our phones, we have access to so much information, but we also need to make sure that it's relevant information to our community. So again, part of what I love about community health workers is that you're very, they tend to be very focused on a very close-knit, smaller community. And so it's important to find out what you can that best fits your particular community. But it's also important to make and maintain those connections, not just look on websites, because as Cheyenne was mentioning, things do change from day to day. And it's important to then be able to have more personal relationships to really get the correct information. It's also important because you want to make effective referrals, right? So the last thing you want to do is give someone a referral that's outdated or give them information that's incorrect. And so it's very important to try to maximize relationships so that you can get the correct information. And then also you want to further the mission of your individual organization. So again, part of selling yourself and your organization. And I mentioned this too, because in my work, there were some things that have surprised me. And so, for example, I go out to rural counties a lot and I love it. But I was surprised that there's a lot of resources. So a lot of times what I would hear, of course, sitting in this big cities in San Antonio and Houston is, oh, the rural communities don't have resources, they have so many needs. And what I found is that they actually have sometimes a lot of resources. They're just not getting to the right people. We're not getting them down to the community for a large variety of reasons. But part of it is that I feel like we're just not getting all the right information, and then finding people like you guys and CHWs to sort of bridge the gap between what the resources are and getting them to our community. So super important, I think, this topic is, even it's considered a soft skill. So opportunities for relationship building, how do I get started? I think it's very common to kind of think about like, well, this all sounds great and good, but it's a little, probably maybe a little intimidating for some people, not for everyone, or you may not necessarily be something that you think you might be good at. But actually, it's easy to get started, and once you kind of know and have some tools in your tool belt to kind of get started, then you can do it. So the other thing I wanted to talk about, the next thing I wanted to talk about, what is looking for these relationship opportunities. And some of them are sort of intuitive and kind of, they come in easily, again, depending on the kind of work that you're doing. But some of them you might not have thought of. And that's because I had not thought of some of these as I started doing my work with TEPHI. So this is kind of a busy slide, but I'll try to walk through it slowly. So the first opportunity is sort of common sense, but sometimes we forget, and even I forget about it. I work for UT School of Public Health, the UT Health in Houston, super large organization, one of the biggest employers in Houston. Obviously, I don't know everyone in my organization, and sometimes I forget that I can reach out to people in other departments, other faculty, depending on what they're doing to do. So look within your own organization, depending, on the size, of course, but maybe think outside the box of someone that maybe you don't work with every day, but might be able to help you spread out some of this information or give you some ideas of other ways to connect. So, of course, your employer and even your circle of friends, if you're out in a PTA meeting or, any kind of other things that you might be doing in your personal life, and you meet someone, kind of get in the habit of being comfortable to say, oh, what do you do? This is what I do. I'm trying to get my organization more involved in the community. Something I hadn't thought about, and I've been going to some meetings for the Alcohol and Drug Society in San Antonio, is like neighborhood meetings on HOAs. I had not even thought about that, but that's a great place to bring some of that, again, community information to the people. Other things that I think a lot of CHWs do very well is really look at community organizations, but sometimes, again, thinking outside the box. Some of them are very obvious, right? Civic centers and community centers, but libraries, schools, and faith-based organizations. What we learned in COVID, and we probably did some of it to some extent before COVID, but it was really glaring during COVID, was how much our churches and these community organizations helped us help public health spread the word, right? You may remember there was vaccine distributions in some of these centers that were not in hospitals or clinics, which is really, for the first time in my career, we were telling people, do not go to the hospital, do not go to the clinic. They were turning you away. But this community centers and churches and other community places stepped up to help, and were right there in the neighborhoods. They usually have trusted leaders, right? There was so much mistrust and issues during COVID. And so these trusted leaders in those communities were able to help us bridge the gap. And something that I think about, I recently heard a quote about, by the time you need a friend, it may be too late to make one. And I thought that was a good thing to think about, not to be pessimistic, but what they were trying to say is, if you start looking for these relationships once the emergency comes or the event comes or the thing that you need to be done, it might be a little too late, right? You want to forge these relationships ahead of time and have people ready, sort of to call on, but establish them, right? Because it's a two-way street. It's not just what you can get out, but also how you can provide help to other people. But really identifying leaders and stakeholders, community stakeholders in these organizations, I think it's a real big key to extending your reach and trying to reach communities. The other one is what you're doing here today, professional organizations in your area of work or interest. So, join your local CHW associations, your state CHW associations. What I find is that a lot of times you get in these mailing lists, and sometimes some people find it a little bit annoying, right? You get a lot of emails, but you never know And that one email is going to lead you to somewhere, somebody might advertise or, be distributing information of a particular thing that might interest you or be very relevant to your particular work and job. And then you can, of course, use it in your community. And then organizations in your area of work or interest. Oh my gosh, there's everything, right? So we know that there's an organization for every disease, as I like to call it, the American Cancer Society, the Diabetes Society, the Leukemia and Lymphoma Society. And so there's something specific that you're particularly interested in, or maybe you've had a background in that. Reach out to those organizations. Usually they have local chapters and state chapters and county chapters. And again, really good source of information that you can bring back to your community, but also they help you connect because they've already done some of this relationship building. So sometimes you don't have to reinvent the wheel or start from scratch. You can connect with people that can help you then connect with others. Local, county, state, or federal government agencies. I think this one's a little bit intimidating sometimes. You think, well, how am I going to do that? But in fact, a lot of these agencies, so obviously I work for a state agency, but what I find in a lot of the meetings that I go to, community meetings and emergency planning committees in different cities and counties, is that they usually have a representative from various agencies. And so you have one person who is usually assigned, like myself, to a specific area or community. And so you can reach that state agency through that one person, right? It's not like you have to go to the head of the state agency, but you can reach that person and they can also help you because, again, they've done some of this legwork for you. They've already, they're investigating what are the best ways to get to these communities, what are the best ways to distribute information, what has worked in the past or what hasn't worked in the past, and they can be very, very helpful. The one that I didn't think about before that surprised me in this role was for-profit businesses. And I can kind of see, much of what we do, of course, is healthcare related. And so how do these for-profit businesses, but I'm a member of a committee here in San Antonio, Burke County. It's called EMSIS for short, and it's the Emergency Management Coordination and Information Sharing Committee. So long name. But basically what they're trying to do is they're trying to bring emergency management information to all of these organizations that I'm listing on here, right? They have state organizations, they have, volunteer organizations, all of these organizations, but they also invite businesses. And so I was very surprised to see that CPS, the energy company in San Antonio, so I don't know if some of you are not in the area, but the energy company in San Antonio, the water company, Whataburger, we've all heard of Whataburger, USAA, which is one of the largest employers in San Antonio, and the military community. And what I found interesting is that they're invited to these meetings to provide information about their businesses, but also to gain information from emergency management. So for example, those of you in San Antonio in this area, you probably get those emails now from CPS that tell us, there's storms in the area, be aware there might be power shortages, or from ERCOT, the famous freeze that we had. Now they let us know, right? Try to minimize use. This is where we are. And some of that came from coming to these big meetings, being partners with these emergency management and state organizations to provide, again, improving our communication with our communities. And so for-profit business can be very helpful, again, because they're trying to do the same thing you are, trying to reach our community, trying to provide information, and they might be helpful if you identify somebody. And sometimes they can also help you with money, right? The HEB, for example, is a big partner in some of these state agencies. So sometimes they provide, goodies that you may have at a table, for example, if you're going to a health fair. And they're actually very willing to work with you. Again, if your mission and what you're doing seems, worthwhile. But that's one that I hadn't thought about. So really keep your eye out for that as well. And again, in your personal life, you may know a friend who works in a certain place that might be able to help you with that, or your organization if that's not something that you do directly. Nonprofit organizations, to me, is sort of the no-brainer, right? Those are the ones that really are want to doing, again, some of the things that you're doing. They're very interested in passing on information, and they usually need people. And so you may not necessarily work for them, you may not necessarily volunteer for them, but you can definitely collaborate and passing on information, whether it's, drug addiction or substance abuse or, different illnesses or different issues that are going in the city or in your community. Volunteer organizations is another one that we don't think about. And as Cheyenne was talking about, some of you, and obviously I don't know the exact makeup of the people in this webinar today, but if you don't have a job or you're in between jobs, because like she mentioned, CHWs, unfortunately or fortunately, sometimes you go from place to place depending on the need. And so a volunteer organization is a great way to kind of keep your skills up, but also continue to make connections, right? You go somewhere and you volunteer for a little bit, and they get to know you, you get to know them, and you may also find a passion that you didn't even know you had, or you may find a really connection with something that maybe you didn't know. So volunteer organizations, both in their mission of what they're trying to do, and also as volunteer opportunities. And then the last one, probably not the last one, this is not an over extensive list, but the ones that I think about are trainings and conferences. So exactly what we're doing today. I never used to think about trainings and conferences, to be honest. It's a networking opportunity. I used to kind of sit in the back, stick to myself, and concentrate on learning what they were trying to present. But I learned actually that they're very good ways of connecting with people, because generally y'all are there for the same reason, right? You have an interest in whatever the conference or the training is about. You have that commonality that's built in because you're there probably doing kind of the same similar things. So some of you may or may not have gone to conferences, large conferences. Again, sometimes they have big rooms with lots of tables and they're giving out goodies, and, you're collecting pens and, notepads. But it's worthwhile to ask questions and get to know that person. They appreciate it because, they're selling themselves, they're selling a product of information, but you never know when that connection may really lead to something. And actually, I was very surprised last year that I made some really interesting connections by stopping at a table, asking questions, being willing to listen to what they had to say. And even though the topic on the outside didn't look like it was something that I was interested in or my organization was interested in, it actually proved very helpful down the line. So these are all just sort of a quick overview of things that you might want to think about as you're networking, as you are improving your relationship building, and places where you can connect with other people. Really, the word is connecting. So I think that relationship building has some built-in things that are very intuitive, right? So just like in our home lives, in our personal lives, we all are constantly building relationships, whether it's with our family members, our colleagues, our friends. But I think in our line of work, so in our, I put it in quotes, in our line of work, I think that there's some very basic elements that we should really think about as we're trying to build these relationships with partners and community partners to do our job. And I included, establishing and maintaining trust. And usually when I want emphasis on something, I put it last. But I think this is so important. I think that's probably 90%, I think, of a relationship building is establishing and maintaining trust. And I'm going to touch on it a little bit more in a second, because it sounds really basic and intuitive, right? It sounds like, well, of course, you need to be honest, you need to be compassionate and kind and all those things that we know to do. But again, in our particular work, I think we need to go a little bit further with that to make sure that we're establishing that trust with our partners. Meet people where they are. And I'll also talk a little bit about what I mean by that. Know your audience, really important. And then establish commonalities, which again is a little bit more intuitive and makes a little bit more sense. We all think about that, right? As we're building relationships, it's just easier to connect with people when you have things in common with them. And so establishing and maintaining trust. And what I mean by that is, again, you have to form relationships with, essentially strangers, but you also want to make sure that especially in health and public health, in communicating wellness to our communities, we have to make sure that people trust us. So that's another lesson I learned during COVID. And some of you may remember some of these things. People lost a lot of faith in the public health community, but also in medicine in general, because there were so many things that we just didn't know. And I think it was hard for anyone to admit, well, we just don't know the answer to that. We truly don't know. People thought we were making it up. Well, we didn't know. Nothing, we had never seen anything like this, much less in the entire world. And so trust, I think that I think as when I say we, I really mean public health, but I think CHWs by default a little bit. We've lost a little bit of public trust. So when we're building relationships and we want to make sure that we're forming this partnerships, showing up. So show up, I think, is a basic element of that trust. And what I mean by that is literally show up. Especially if you can do it in person. I know we all love webinars. They're so convenient and it's easy and nice. But as we're getting back to the normal world, showing up to community events, to health fairs, I think it's a really good way to show organizations that you support them, that you want to learn about them, that you want to, again, create a partnership or a bond or communication with them. And the only way to do that is to show up, right? To be there. But then the second one then next to that is come back. So don't just show up one time, consider coming back. Come back a second time, a third time. I'll share a story with you about reaching out to the rural communities. Again, I mentioned there's a little bit of distrust with, public health. Here's this person, I'm a doctor, I'm coming in from TEPHI in Houston. And, they welcomed me, they talked to me, they were willing to, allow me in the room and share some experiences and learn about what they're doing. But I think they weren't really sure, right? We're probably never going to see her again. But coming back time and time again, after the fifth time, the welcome I receive is completely different, right? They're happy to see me. By the time they know me, they invite me to talk, they invite me to participate in things, because I feel like I've established a little bit of trust with them to say, hey, I'm showing up, but I'm also coming back. So it wasn't a one-time thing. The next one, I think, again, is intuitive, right? Keep your commitments. So if you say you're going to do something, follow through. And the big suggestion I will give you is then try not to overcommit. So when I was very young, something that was very hard for me was to say no. It was very hard for some of us to say no, right? Can you do this? Can you volunteer for this? Can you show for this? And we just can't say no. But really, as you're developing your soft skills, really think about that. It is okay to say no sometimes. But you need to just be very careful not to overcommit yourself so that you can follow through. And so I think that the message is, in order to follow through, you must not overcommit. And in order to not overcommit, sometimes you need to say no, which is completely okay. And then the last thing I want to talk about is knowing your boundaries and your scope of practice, again, in maintaining trust. And so as I was reviewing for this presentation, I was trying to remember if when we had our present where we did the certification in public health, and in community health worker, if they discuss scope of practice. And that's super important in terms of some professions, like, of course, nursing, doctors, respiratory therapists, but even outside of medicine, right? Lawyers, civil engineers. There are very specific things that people can and cannot do when they're working in a professional fashion with a certain title. And so I just wanted to very quickly, and I'm not going to read all of this, but the scope of practice for CHWs has to do with, well, it's very varied. So just like myself, it varies depending on your education, your training, your experience, what you've done before. But there's some very common roles and responsibilities that a lot of you may do. And again, I'm not going to read every single one of them, but basically it has to do with providing, appropriate health education, advocacy, coordinating care, enrolling people, making referrals, connecting clients, cultural competence. But something that we don't talk about a lot sometimes that's not written is making sure that the advice that you give, that your boundaries. And I'll give you an example. When I was running the contact tracing program in San Antonio, we talked to people on the phone, thousands of people a day, as we were calling to do the case investigation, the contact tracing. We had lots of questions for them, but they also had lots of questions for us. And so our group, just to give you an idea, we had at the highest point, we had 160 people that were working these call centers. And the education and their experience ranged tremendously. So some were recent high school graduates, some of them were medical students or nursing students, masters of public health students. Some of them were epidemiologists like myself. It was a big range. Some people were, retired, and some of them were CHWs. And so they had a big range. So when they were talking to these patients or these community members, rather, they would have some questions. And, at the time they were very scared. I mean, I'm talking July of 2020, when there wasn't a lot of stuff that we knew. And so sometimes someone, as an example, would say, they're talking to someone, they're like, oh, my mom is very sick. She's having a hard time breathing. I'm not sure what to do. And, somebody might say, oh, well, my grandma, my abuelita thinks it's a good idea to put, Vicks vapor rub in our feet, and maybe you can try that. And even though it's really good advice, and I'm not necessarily knocking it, because I do have an abuelita and a mom who believed in a lot of home remedies, and sometimes home remedies work. It wasn't within our scope of practice to be saying that, considering what we were dealing with in COVID, right? Someone that was having a hard time breathing, maybe they did need to go to the hospital, maybe they need to seek other care. And so it's kind of a funny example, but what it's really meant to say is that in order to build trust, again, maintain and build this trust, it's very important to know our boundaries, to know our limitations, and to work within that scope. And so that brings me to a big sort of, I would not necessarily call it pet peeve of mine, but it's the importance of the I don't know, and followed by what. And what I mean by that is, as you're out there in the community, again, building bridges, building relationships, it's okay to say, I don't know. So just like I mentioned a minute ago, it's okay to say no. It is very important to say, it's okay to say, I don't know, if you don't know. And that's something that took me, again, a little bit of time to realize in my professional life, because, after all, I was becoming a doctor. I felt like, oh my gosh, I don't want to say, I don't know. It was hard for me. But it is very important to say, I don't know, when you don't know. And perhaps a better wording to that, something that I've taught my kids, and it's funny because my kids have gotten really good at that now, and I love it, is instead of saying, I don't know, is to say, you know what, I'm not really sure, but I can either help you get the information, I can get back to you with the person that might know that information, or I might research it and I'll get back to you with that information. And so I drive the point home of this because, again, in building and maintaining trust, I think it's very important to really think about those things, and really know your limitations, your boundaries. And I think all of these things, so showing up, coming back, keeping your commitments, and knowing your boundaries and when to say I don't know in your scope of practice, I think will help you establishing and maintaining trust with those community partners and those relationships that are ever so important. Meet people where they are. So this one's much shorter. This just means exactly what it sounds like. As a community health worker, that's exactly what we're supposed to do, to go where they are, not expect them to come to us. And sometimes by the nature of our work, you may work in a clinic that has, events in the clinic, but it's really important to also go out into the community, to participate in those events, to go where they are and become a supporter of those things that other people are doing in your community. And so I hear a lot about this, pardon me, in other conversations, but it's really important. And that's also part of building trust, right? Going where they are, not expecting people to come to you, because that's, again, in our titles, we're community health workers, going out to the community. Know your audience. I think this one is important. And this one caught me a little bit by surprise, even for me, because sometimes we make assumptions about what's happening in our community. And sometimes we go out there in a function and we may ask questions that they've already been asked 20 times, and they kind of get a little annoyed with you because at some point they're like, wow, you obviously didn't do your homework. I mean, you've already asked me that, or somebody's asked me that 20 times. So really, when you're out there, again, trying to build relationships, depending on where you go, make sure that you know your audience, knew who you're talking to, especially if it's something new or unfamiliar to you, because that's another way to really quickly erode trust, right? That you're not prepared. It's just part of being prepared and ready and willing to participate in these things. You want to know your audience as best as you can. And then the last one that of my elements that I talk about is establishing commonalities. And I think this one's probably the easier one of them all. Looking for areas of possible collaborations. What are things that that interest you, that interest your organization, that you think are interest to your community or a big need to your community? Identifying those shared goals, right? Again, you'll find that most of the time at a lot of these meetings, at a lot of these community events, a lot of these activities, we have so much more in common than we even think about. And of course, then establishing and encouraging mutually beneficial partnerships. You want the partnership to work for both of you, just like in a relationship with your partner thing. You want it to work for the organization that you're trying to connect with, but also work for yourself. And so those are very important and kind of simple things. Like I said, a little bit intuitive, a little thing makes sense, but I think it's good to sometimes hear it and kind of think about it a little bit more as you're doing these things. So practical matters. So don't be shy, get out there. Sometimes it can be a little hard, a little intimidating, but usually, especially if you have a partner or if you have someone that you work with, you can go together. Sometimes it's easier to buddy up with someone and go out to communities. Again, one of the ways I have found to get a lot of information, and so much of my work now has come from me attending these meetings. So for myself, I try to attend, they call them like community resource meetings, because I work in such a big region. So obviously I don't have just one tiny small community, but I have to go to different communities to then figure out where are the stakeholders, where are those leaders in those communities, what are they doing? Some of the counties don't have public health departments, so they rely on emergency planning committees to get some of this work done. So get out there, try to join committees. Again, if you work in some of those organizations and some of the ideas that I had, somebody may provide you, hey, where do you go in this particular community to get some research and information that can kind of help you. But once you get there, take notes. So this may just be me in my old age, but I don't remember things like I used to. But I like to take notes as the meetings go by. Sometimes I used to wait till after the meeting, or sometimes I would wait as somebody finished speaking. But what I do now is if somebody's going around the room, for example, introducing themselves and their organization, I immediately write their name and their organization, because sometimes these meetings, they don't provide kind of summaries. They say they do, but sometimes they don't. And so you have the information if there's someone that really piques your interest or somebody that you really want to follow up with. So take notes as you go to meetings, or if you're meeting, out in community events. Prioritize, kind of think about who it is that you want to meet. Obviously, it's impossible to meet everyone every time, but I tend to prioritize to identify, hey, those are the people that I really would love to make a connection with, or they talked about a resource that would be really, really important in my community, and sort of aim for talking to a few people after a meeting based on those notes and your priorities. As for business cards, I know a little bit now. I find that it's kind of, again, I'm old school. People are kind of going away from business cards for various reasons, but you can also ask for a business card, contact information. People now share the contact information of their phones. And of course, if they have any literature, a lot of times, a lot of these organizations will have literature, pamphlets, or websites that, like I provided today, that have information about the organization and more information that maybe you can get in that quick meeting. So make sure you're writing notes and then keep them organized. So what I do, again, I'm a little bit old school. I have a big folder that has like little specific places for business cards. So I keep that. I also take pictures of them and keep a sort of electronic file of my business cards. And then I generated a spreadsheet to also keep this information. And I try to write, because then I forget. And again, I talk to a lot of people. I try to write where I met them, or there was something particularly that they were interested in, or that I was interested in working with, so that I have a record of that. And what I also suggest is, if you do it as you go along, it's much easier than trying to do it later, if you collect them and then try to put it together. If all else fails and you're not making a personal connection, if you're not able to reach out to someone in person, consider email communications. I'm a little less, I emphasize that a little bit less, because one, I think some people just get thousands of emails. And also, people are more likely to respond to you if you've met them, if you made a personal connection. Although, sometimes you might be surprised, and sometimes you may not have the opportunity to meet them in person. So it's okay to send an email, a professional sounding very nice email introducing yourself, introducing your organization, and again, trying to find ways to collaborate, because you never know where your opportunities may come from. So I'm a little bit getting short on time, but I will tell you a quick story. So I mentioned that I was working as an epidemiologist at San Antonio Public Health before I went to contact tracing. And how I got there is I sent an email to the director of mental health at the time. I didn't have her email. I didn't really know anybody who worked with her, but I sort of just guessed her email based on organizations. They usually have a very specific kind of way that they do, first name, period, last name, at whatever. Anyway, I sent her an email right when COVID was starting. I really wanted to help. I wanted to see if there was a way I could help. Never in my wildest dreams did I think she would return my email, especially being so busy, but she did. And a week later, I was working for mental health. So you never know when the opportunities are, even if you can meet somebody in person. So as well as asking for business cards, try to have a business card yourself. Sometimes, it doesn't have to be fancy or embossed if your organization doesn't produce it. Nowadays, there's lots of, we all have printers and computers at home. There's little templates. You can put your name, your email, the name of your organization, and maybe a phone number. So it doesn't have to be fancy or complex or anything like that. But it's good to be able to hand to people because, again, they're more likely to return a call, return your email, or remember you if they have something. But of course, sometimes people, again, like I was mentioning, they have QR codes now that you can set up, or you can just share a contact phone. But I still find that business cards work well, although the practice is kind of going away. Create and maintain a list of contacts. I already talked about that. And then the short-term follow-up and a long-term follow-up. So super important after you've met somebody, especially if you met them in person, send a little email saying, maybe a few days after you've met them, hey, it was great meeting you at such and such place. We talked about the possibility of this. We'd love to hear from you. And then set a little bit of a deadline. So you don't have to set a deadline, especially if you have something coming up that you really want to participate, or you have a deadline, but maybe just sort of like, hey, I would love to hear from you, within the month or within 2 weeks because of this. And sometimes people like that, actually having a bit of a deadline. Otherwise, they may just look at it and may not get back to it if it's not something that they're prioritizing. And then long-term follow-up has to do with exactly what that sounds like. If you didn't hear from someone, or maybe at the time you didn't have a project or something, or you didn't have necessarily information to get from them that matched what you were trying to do, but later you do, circle back and just send another email and say, we met back in, December, we talked about this. I was just circling back. If there's anything new from you, or if you have something new to share, super important to do those follow-ups and keep organized with that. So some conclusions, as I think right on time, hopefully. Make sure that you have fun and try to make it fun and interesting. Try to reach out to people that you connect with, that you like, that interest you, so that you can bring these things to your community. It doesn't have to be intimidated. It doesn't have to be super formal either, but make sure that it's something that interests you so that you can be yourself and represent your organization the best that you can. So seek out like-minded individuals. And again, you'll find that we are all a lot more like-minded than we think. And then as you build and maintain these relationships, build and maintain trust, meet people where they are, remember your limitations, and then try to establish commonalities for the best results. So that was pretty quick. I hope that you got something out of it. And I'm sure, I guess Cheyenne maybe will monitor if there's any questions.
Yes, thank you so much. That was great. I have one question, but seeing that time is short and great timing, I want to open it up first to our audience. If anyone wants to come off video or audio, or put your question in the chat box. Okay, I'm gonna ask my question. So I really picked up on your section when you were talking about showing up. And then earlier about making sure that you're engaging with people at a conference or any type of meeting. I find it really easy just to like sit in the back and not say anything. And Marilu, maybe you remember this about me when we met, is like I didn't say a word at that meeting, but then you like turned around and talked to me, and all of a sudden I'm like this chatterbox. And so I know that about myself. I often rely on others to start the conversation. Do you have any suggestions for how we can step up, raise our hand, be more engaged, especially if we're nervous or tired or whatever else is going on.
Well, I think that at the end of the day, you just have got to have it present in your mind what your goal is, right? What am I here? What am I trying to do? And what am I trying to bring back to my community? And it is, I mean, even for me, even to this day, I mean, it's not always super easy to do it, but you just really have to decide, this is my goal, and I just have to step up and do it. But generally, like I said, once I prioritize, I look around the room and I think, okay, these are the people that I really, really want to get to. Then I just really reach out to them, just stand up and try to grab them and, make sure that I meet them. The other way is to, like I said, sometimes go with a buddy if that's something that might help you. Sometimes that's very helpful to not just be by yourself. But then also sometimes there's someone in the room that already knows that person. So you may even go to someone that maybe it's either easier to talk to, or maybe you've connected with them before and say, hey, would it be possible for you to provide an introduction to this other person? Or do you have any ideas how I can reach this person or this organization? But really, I think it's just if you keep your goal in mind of what you want to accomplish, and really do that. And like I said, I was kind of the same way at conferences. I didn't really want to talk to people at tables. I kind of found it annoying. I didn't, I wasn't interested, because again, we kind of judge something by their cover, right? If the title of their table, their organization. I was like, but this last few times I've been so surprised, so the proverbial don't judge the book by its cover. I've been so surprised that I go in, I introduce myself, I tell them about me, and then they tell me about their whatever they're doing. But usually you can find something they can both benefit from. So you just have to get out of that comfort zone and just do it. And then you'll find that people are the same way as well. There are a lot of people have the same issue. And sometimes when you realize that, it makes it much easier. So I've been making a lot of friends with people sitting next to me in trainings. And again, we find, oh my gosh, you work for the Department of State Health Services and you're doing this, and maybe we can connect this way. And so really just trying to get out of that comfort zone, but it does take effort. I mean, I have to say it's not so easy, even for those of us who are chatterboxes, to really take that first step. But then also be open to other people coming to you. So body language, the way you sit, don't cross your arms, don't, kind of hide in the corner, sit in the middle, take a chance, sit in the front, raise your hand, so that people also feel welcome for them to, sometimes they want to talk to you as well, depending on, your organization and what you're doing.
Thank you. Very helpful. So I just re-entered the links from earlier. So that second link is for certified CHWs, or sorry, the first link is the one you need to complete the survey for today. Dr. Vazquez, you're getting a lot of thank yous and good information, good content messages in the chat box. There was so much across all industries and stakeholder events. So thank you.
That's wonderful. Thank you, everyone, especially for your attention and your time. Our times are very, very, very important. And, we all are always short of time. So I appreciate that. Yeah, I'm reading them now. That's wonderful. Thank you so much. I love it. I love it. And keep doing what you guys are doing. Great work, Cheyenne. My hat off to you. Y'all are doing amazing work. So proud of you. And I will continue to partner with you in future things and continue to help you with your mission of getting this information and all these workshops and things out.
Amazing. And anyone who is on, the invitation is open to contact Marilu to continue your networking journey and get to know more about TEPHI and those opportunities. Awesome. Well, thank you all. See you next month for our public health series. And Marilu, I will see you soon, I'm sure.
Yes, I miss you.
Yes, get some coffee.
I do, yes.
Yeah.
Definitely.
Awesome. Okay, bye everyone.
Bye.